Okay, so moving on to the chapter 14, the mental behavioral criteria. So in your AMA guides, we're now on chapter 14. Again, there was no GOS chapter. GOS is an independent scale outside the AMA guides. So very similar to the GOS, the chapter 14 really is based upon functional limitations or a disability approach as per the WHO rather than being the SABS-based definition. Within the AMA Guides Chapter 4, it references that one must use the DSM as the diagnostic system, as the first step in a mental behavioral evaluation performed by a psychologist or a psychiatrist. Both are used. Some teams will have two involved. Most will have only one. As long as they're properly trained and certified, we've trained many psychiatrists through this program over the years. So the main thing is as long as people are properly qualified. But it generally, the DAC manual would have specified that a psychological associate is not considered to be someone with sufficient qualifications. Certainly the psychotherapists that are about to be registered would not be considered to be, social workers are not considered to be. So it really does come down to actually trained psychiatrists and psychologists for this domain. At the time of the writing of the Chapter 4 of the AMA Guides, the third edition of the DSM. Everyone's familiar with DSM? Yes? Do I need to explain to anybody? Don't be shy, please. Okay. So it was the third version of the DSM. And we are now up to the 5th edition. So that interjects a little bit of controversy because the SABS says that we must use the 4th edition of the AMA Guides. The AMA Guides specifies that they reference the 3rd version of the DSM, but while it has become common practice to evolve the diagnostic system, as long as it's DSM based, we can't do the same thing with the AMA Guides because they are clearly written in the SABS in stone. Even though we're up to the 6th edition of the AMA Guides, in Ontario, for purposes of MVA, insurance, catastrophic impairment rating, we have to use the 4th edition. The WSIB, I think, uses a second and plus a bit of a hybrid. Jurisdictions across the US, they still give guides training in the 2nd, 3rd, 4th, every single edition because different jurisdictions for their WCBs and their motor vehicle accident regulations, depending on when they were enacted, they all reference the then most updated AMA guides for the time. Unless your system specifies that you can then evolve with the guides, which most seem not to do, then you're stuck with the one that's actually named. So we have, though, evolved to DSM-4 TR up until now from the DSM-3. Most of us, because they were substantial improvements, especially in the area of chronic pain, but in other areas too, we felt very comfortable migrating to DSM-4. No one really stuck with the DSM-3. We're now faced, though, with DSM-5, which has been extremely controversial.